Welcome, and thank you for viewing Understanding the Catheter Inserted and Left in Bladder Quality Measure. This presentation is one in a series of videos explaining the quality measures that comprise the nursing home quality measure domain of the nursing home 5-star rating system as displayed on the CMS Care Compare website. You may find it helpful to have a copy of the current quality measures user's manual turned to the % of residents who have had a catheter inserted and left in bladder long stay quality measure page when viewing this video. The link to that manual is found on the next page. Additionally, MDS 3.0 sections H and I are included in this quality measure. This presentation contains information from the MDS 3.0 RAI manual and the MDS 3.0 Quality Measures Users Manual version 14, accessed in June 2021. This presentation is meant to enhance your understanding of the quality measures discussed during the presentation and is not meant to take the place of or be all-inclusive of every bit of information and instructions provided by the MDS 3.0 RAI manual and the MDS 3.0 Quality Measure Users Manual. Any updates to either of these manuals will supersede content presented, and the most current manuals should be utilized at all times. The links to the official CMS site providing MDS 3.0 and MDS 3.0 quality measures materials are provided on this slide. During this presentation, I will refer to the target assessment. This is the reason for the MDS assessment. The federally required OBRA assessments are completed on admission, quarterly, annually, and with a change in status or a significant correction to a prior MDS manual, MDS assessment. Admission assessments are not included as target assessments for this QM. For OBRA assessments, MDS item A0310A is coded as 2, 3, 4, 5, or 6. Another reason for a target assessment may be a discharge assessment. The discharge assessments considered for this quality measure are those coded as 10 or 11 in the item A0310F, return not anticipated or return anticipated. PPS 5-day assessments are not included in this quality measure. Each of the MDS assessments has a target date, also known as the event date of an MDS record. The first type of record is the entry record. The target date for the entry record is the date the resident entered your building. For discharge records, the target date is the date of the resident's discharge. The discharge record is coded as a resident whom you are not expecting to return, or as a resident you are anticipating to return to your facility. Deaths in the facility are also coded as a discharge record. For discharge records, the actual date of discharge or death is coded in item A2000. For any other assessments, such as OBRA required admission, quarterly, annual, or significant change in status, or the PPS assessments, the target date is the assessment reference date, or sometimes called the ARD. The ARD or target date is the last day of the resident's observation period and is MDS item A2300. For example, if an item on the MDS has a 7-day look-back period, the information collected for the 7-day period will end on the ARD at midnight. For each of the target dates, you will want to make sure that you include anything that occurs on that date up until midnight. The catheter left in bladder quality measure is a long stay quality measure pertaining to residents who have been in your facility for 101 days or more by the end of the target period, as we discussed on slide 4. A resident must be in your building for at least 101 days to be included in the long stay measure. A couple of points to keep in mind is that only days within the facility count in the 101 days. Excuse me. When calculating cumulative days in the facility, or CDIF, the day of entry counts, but the day of discharge does not. However, if a resident is admitted or readmitted on the same day as they are discharged, then the resident is considered as having a 1-day stay. Long stays may include one or more interruptions, indicated by an interrupted stay, where A0310G1 is coded as 1, as long as it is 3 days or less. Now let's look at the catheter left in bladder quality measure more closely. On the CASPER report, the numerator is the actual number of residents who were impacted by the quality measure condition during the report period. This example shows one resident is included in the numerator as having an indwelling catheter during this target period. To be included in the long stay indwelling catheter numerator, the resident's MDS at item H0100A needs to be coded as having an indwelling catheter during the 7-day look-back period of the MDS assessment. Suprapubic catheters and nephrostomy tubes are coded here and included under the indwelling catheter item. Again, on the CASPER report, the denominator is the number of residents potentially impacted by the quality measure during the report period. So in this example, 48 residents are part of the denominator. For the long stay indwelling catheter quality measure, all residents who have a stay in your facility 101 days or more with a target assessment as discussed in slide 4 are included in the denominator unless they have an exclusion. Exclusions are certain conditions that will exclude a resident from being counted in the numerator and the denominator. There are 4 conditions where long stay residents are excluded in the long stay catheter inserted and left in the bladder quality measure. The first exclusion are residents whose current MDS is an MDS admission assessment or a 5-day PPS assessment. By excluding reports of indwelling catheter on admission or the 5-day PPS assessment, this allows time for the facility to do a comprehensive assessment and decide if the indwelling catheter is really necessary or not. The second condition that is excluded is where the long stay resident's MDS is coded as not being assessed for an indwelling catheter during the target assessment. In this case, there is a dash in the box of MDS item H0100A where the indwelling catheter is coded. I want to caution you about using dashes. When a dash is used, it indicates that this item was not assessed. The most common use of the dash is when a resident is discharged or dies before the item could be assessed. Dashes should not be used routinely and can affect your quality measures by reducing the size of the resident denominator, causing an increase in your facility percentages, resulting in an inaccurate picture of your nursing home residents or your quality improvement efforts. Exclusion conditions 3 and 4 result from the resident coding indicating an active diagnosis of neurogenic bladder or obstructive uropathy in section I. In addition, if there is a dash in the box of I1550 neurogenic bladder or I1650 obstructive uropathy, the resident will be excluded. The long stay indwelling catheter quality measure is one of the quality measures that includes covariates for public reporting of the 5-star rating system quality measures. A covariate takes into consideration certain factors or conditions the resident may have that affects the quality measure score. For this quality measure, frequent bowel incontinence and stage 2, 3, or 4 pressure ulcers on a prior assessment can create a risk-adjusted quality measure score. For more information, refer to the current MDS 3.0 Quality Measures User Manual, Chapter 3, Technical Details, Section 1, Introduction. The MDS manual provides coding instructions and tips for accurate and proper MDS coding. I encourage you to review the MDS manual frequently, as the volume of instructions and special circumstances cannot be committed to memory for coding all MDS items. But here are a few tips to remember. When coding MDS item H0100A indwelling catheter, there is a 7-day look-back period. This item should be marked if the resident used an indwelling catheter, suprapubic catheter, or nephrostomy tube during any of the 7 days of the look-back period. Condom catheters would not be included because they are external catheters. Do not include one-time catheterization for a urine specimen or intermittent catheterization under the indwelling catheter item. Because the risk of developing a catheter-associated urinary tract infection is high with indwelling catheters, they should be removed as soon as possible. A comprehensive assessment should be completed to identify if there is an appropriate diagnosis and need for the indwelling catheter. As we discussed during the exclusions portion of this presentation on slide 13, an active diagnosis of neurogenic bladder or obstructive uropathy will exclude the resident with an indwelling catheter from being included in the numerator and denominator of this quality measure. Look at the medical record to see if the resident has a diagnosis that may be related to these conditions, such as multiple sclerosis or benign prostatic hypertrophy. Review urology and physician notes for a diagnosis that may not have been kept up on the active diagnosis list. Is the diagnosis for the indwelling catheter urinary retention? What is the cause of the urinary retention? Is it neurogenic bladder or obstructive uropathy? Talk to the physician to see if one of these diagnoses applies to the resident's condition and the need for the indwelling catheter. At least monthly, you should be reviewing your catheter QM with your when looking at QMs that are starred in the far right column labeled Comparison Group National Percentile. The star indicates that the facility's rate for the quality measure, in this instance, catheter inserted and left in bladder QM, is greater than 75% of the skilled facilities in the country. In other words, 75% of the nursing homes in the United States are doing better in this measure than your facility, and therefore you should probably work on trying to improve this QM. Also, on the Casper Quality Level Report, you can see the columns that show the comparison state and national average rates to compare your home status to the rest of the state and the rest of the nation. Again, if your rates are higher than those rates, this might indicate an area in need of improvement. Of special note for this quality measure, you should be looking at the facility adjusted percent to compare against the state and national rates, as this takes the covariates into account. Take a look at your Casper resident level reports. Do these match up with your awareness of residents with an indwelling catheter? If someone appears on the list that you don't think meets the criteria of indwelling catheter inserted and left in the bladder, as outlined in the MDS 3.0 Quality Measures User Manual, and as we've discussed today on this presentation, take a look at the coding of Section I in the resident's MDS. Is there an error? Is the catheter an indwelling suprapubic catheter or nephrostomy tube? Condom catheters are not included as this is an external catheter. Residents may be admitted with catheters that were managed in the hospital or at home. Unless there is an underlying documented condition that necessitates continuing the catheter, an attempt should be made to remove it for a trial period to evaluate bladder function. Under physician guidance, other long-term residents who have catheters may also benefit from a trial removal period. A common pitfall is a missing diagnosis on the MDS in Section I. It may be worthwhile to review residents with either a cerebral or spinal diagnosis, such as a cerebral vascular accident, multiple sclerosis, or stenosis, as they may have a neurogenic bladder but are missing the diagnosis in Section I. Also review residents with benign prostatic hyperplasia and or prostate or bladder cancer, as they may have the side effect of obstructive uropathy, but again are missing the diagnosis. Speak to the provider to see if one of these diagnoses applies to the resident's condition and the need for the indwelling catheter so that it can be documented in the MDS. We do have a tip sheet available on the Great Plains Quinn website specific to the catheter inserted and left in the bladder for long stay. Quality Measures MDS coding tip sheet. This is a resource that should be provided to all of your MDS nurses. There are several resources that you can access to assist you with this when working on the quality measures. We've provided the State Operations Manual link for review of the rules and regulations related to indwelling catheters and to be aware of what the surveyors are looking for. In addition, the CMS policy and memos can provide documentation of any change to the regulation. The percent of residents who have a catheter inserted and left in bladder quality measure is a publicly reported quality measure on the CMS Care Compare website, formerly known as the Nursing Home Compare website. Use this website to view what consumers see regarding your nursing home and the quality measures. In addition, you can see how your nursing home compares with nursing homes in your city, region, state, and nationally. The Great Plains Quinn QIO Nursing Home page provides tools and resources and past training events. Contact your state's Great Plains Quinn Nursing Home contact for more information or technical assistance concerning the catheter QM or any of the nursing home quality measures. Thank you for taking time to learn more about the long-stay percent of residents who have a catheter inserted and left in the bladder quality measure, and for all you do in improving the quality of care for your residents.